Hello everyone, and welcome to this week's video on patient transferring. So the first one we're going to do is the stand pivot, and we're going to move the patient from their bed to a chair. So let's get started. Hi, I'm Stacy. I'll be your physical therapist assistant, your student physical therapist assistant today. And is it okay if I work with you today? We're going to be doing, I'm going to be transferring you from your bed to your chair, and I'm going to have to put my hands on you. Is that okay with you?
Yes.
Okay, so I'm gonna put my gait belt on you. Can you lean forward for me, please? I'm gonna get your hair. So you want the gait belt nice and snug on them. And then you can tuck the rest of your belt into the rest of the belt that's around them. Okay, feels good. Can you scoot toward the edge of the bed where your feet are touching the ground? Okay, and then I'm gonna have you. Can you put your shoes on by yourself?
Yes.
Okay. So you always want to make sure that your patient is either wearing shoes or non-skid socks when you're transferring them, or if you're ambulating them, or if they're getting up at all. So next, I'm going to come and I'm going to block your knees, and I'm going to have you lean towards this hip, and we're going to transfer you over to the chair. So for the stand pivot, we're going to stand you up. I'm going to have you take a few steps, to where the back of your knees are touching the chair, and then I'll have you sit down, and I'll cue you when we stand up and when we sit down. Okay? You understand?
Yes.
Okay. So I'm going to squat. I'm going to block your knees. So I'm going to have you lean towards this way, and you can hold on to my waist. So we're going to lift on 3 to stand. Ready? 1, 2, 3. And we're going to take a few steps. Make sure your knees are touching the back, and we're going to sit down. You feel okay?
Yeah.
Okay, and that is our stand pivot. Now for our next transfer, we're going to be doing the squat pivot, which is pretty much the same thing, except we're not going to have the patient stand and move and take a few steps. We're just going to pivot them straight into the chair. So let's get started. So we already did our introduction and everything. She has her gait belt on, and she has her shoes on. So for this pivot, for the squat pivot, I'm going to do pretty much the same thing I did. I'm going to block your knees, and we're going to move you from the bed to your chair. And you can still hold on to my waist. We're still going to go to this hip. And then I'll cue you when we're going to get up, and then I'm going to sit you down. Are you ready?
Mm-hmm.
Okay. So I'm going to block your knees. Can you lean towards this hip, please? You can hold on to me. Okay. So I'm gonna go on 3. Ready? 1, 2, 3. You feeling okay?
Yes.
And that is our squat pivot. Now for our last transfer, we're gonna be doing the stand pivot with a transfer board. So I really don't have a transfer board, but I do have this board that's going to act as our transfer board. So just keep that in mind, that this is not a real transfer board. So let's get into it. So the transfer, this transfer is going to be sort of like the others, but we're going to use this board. We're going to set it underneath the patient and help them get into their chair by moving across the board. So let's get started. So the patient, we already did our introduction and everything. The patient has her shoes on, and she has her gait belt on. And so today I'm going to be helping you move into this chair from your bed with a transfer board. Is that okay with you?
Yes.
Okay, so I'm going to put this board underneath one side of your pelvis, and I'm going to have you, from there, I'm going to have you put your hand on top of the board, and I'm going to have you, I'm going to buckle your knees, and then I'm going to have you can hold on to either my trunk or my shoulder, and then I'm going to help you lift you, and then I'll help lift you again depending on how much room we have, and then I'll cue you anytime I'm going to lift you and set you back down. So are you ready to start? Okay, so I'll take my transfer board. Can you lean towards this side as much as you can, please? So you want to make sure that your board is in the center or just covered enough so that you have enough room for your patient to slide on. And you want to make sure that it's not too forward or too backward so that they don't have any space to slide off. You want to make sure they're on the board at all times. So now I'm going to get in position. I'm going to block your knees. Your feet are a little bit behind you, so they're more underneath you. And so your hand is on the board. So don't put it underneath the board because I don't want to pinch your fingers. So now you can put your hand up here or right here, whichever is more comfortable. And then I grab your gait belt and we're going to go on 3. Ready? 1, 2, 3. You okay? Mm-hmm. Okay, so I'm going to position your feet again. Make sure they're good. I'm going to block your knees. And I'm going to do that again. Ready? 1, 2, 3. Are you okay? Mm-hmm. Now can you lean towards this way? Take your transfer board out. Are you feeling okay? Mm-hmm. And that is it for our transfer with a transfer board. And that is it for today's video on transfers altogether. And thank you for watching. See y'all next time.